so very much. I think you need to move in because I think you may be hidden a little bit. Great, thank you. And can we have the poster come over here, please? Yes. This easel? Yes. Thank you. Needs to come this way? Yeah, thank you so very much. Absolutely not. Thank you. And they're supposed to be behind anyhow. I'm so sorry. Can you all assist them for the flags to go behind us, please? Thank you. Yeah, behind the chairs. And then this needs to come closer. Thank you. Tell me what you need, gentlemen. Staff will be able to be helpful to you. I think they're all gentlemen there. And let me just first.
You have a glare. Is it from the poster? Yeah. Is it from the poster?
Yeah. It's from my lighting on the poster.
Oh, your lighting. Okay, so
Can we put it in a different location on the other side?
Should we put it on the other side? Would that be better?
You think the other side would work?
Let's try the other side. Okay. Yeah, if you all can move it to the other side, we'll try the other.
Yeah, but they're covered. But
is that a little bit better?
Oh, well, maybe we should. Yeah.
Maybe we should.
Yeah.
Yeah. Is it better on this side?
I think it was better on this side. Were you guys better with it on the other side?
On this side? Okay, do we need to go ahead and move it over, back over?
I would say so.
Okay. Isaiah, can you all move it back towards this way?
Sorry.
Nicholas, if you can help to move the back over towards this way. Yeah, I think we said it's better on this side.
Nicholas, I think you were the expert on this.
Alex.
Yeah, I don't know how you did this. Expert in chief.
Okay, thank you. Good afternoon. I'm Congresswoman Sheila Jackson Lee. I represent the 18th Congressional District. As well, I've served on the Homeland Security Committee, and in the midst of the COVID-19 pandemic, we organized the bipartisan COVID-19 task force in the United States Congress. That task force is now going to turn its attention toward monkeypox. Let me raise an alarm. I'll even use the word crisis, but at the same time, I will engage very important representatives of the health community so that we can put monkeypox in balance. But as we can see, it is unsightly, it is undesirable, and it is infectious and contagious. Right now in New York, there's 778 people who have tested positive for the arthropox virus, monkeypox, and the monkeypox outbreak is growing in New York. I think there are about 2,000 cases in the United States, and I think it is important to know that anyone can spread the monkey virus. It is not a disease that is transmitted only by sex. And there are at least 2 children that have been designated or diagnosed with monkeypox here in the United States. So today, I will be calling on the administration to immediately begin to produce the monkeypox vaccine here in the United States. Tomorrow, there will be a coronavirus vaccine summit in Washington that I will participate in. It is virtual, and some of the leading members of our community, including Dr. Hortez, will be engaged in that. My message will be that it is crucial that we begin our own production. Right now, the United States is importing vaccines. Just as an example, I was recently in New York where I have these facts, and they're not getting all that they need. It's very difficult to predict how much vaccines, and maybe our physicians and health professionals will give us a better sense of it, to be able to get it in as monkeypox begins to spread across the United States. I think the one element that I want to make very clear, because people tend to dismiss and stigmatize communities, let's not stigmatize anyone. Let's not say it's them, or it's in that neighborhood, or it's in that community. Monkeypox can be gotten by anyone. It can be spread by anyone. So let me begin. On July 15, 2022, the White House announced that it was ordering 2.5 million more JYNNEOS doses and to make additional 131,000 doses available immediately to states and jurisdictions. This order follows a July 1 order for 2.5 million doses that will begin arriving in the strategic national stockpile over the next year. Deliveries from the 2.5 million dose order will begin arriving in 2023, bringing the federal government's available supply of vaccine to treat monkeypox to nearly 7 million doses by mid-2023, which gives you a sense that this administration, which I do want to applaud, is aware that the monkeypox may surge. And the only way that it surges is if it is in the general population as well. And that means that it is contagious because it adheres to skin contact. I'm raising the alarm because I want us to be prepared. I want the nation to be prepared. I am told, as I proceed with my remarks, that it does not generate in death. But all of this is speculative in terms of not knowing how it may impact people with underlying conditions. Again, I do not want to raise that specter. We're still in the midst of monkeypox in this country, but I want us to be prepared. I want our public health to be prepared. I want them to have the resources they need. I want them to be able to give information unrestrained. And I want them to be able to give the information in our neighborhoods, in our local clinics. We want printed material in our clinics. And we want state to have information as well as our local health professionals and hospitals. As I indicated, 7 million by 2023, but we are ordering them. And the question is it fiscally feasible that we can produce, or can we determine that the supply chain will not be stopped? That's the concern I raised today. We cannot wait until 2023 for more vaccine to arrive. The global demand for monkeypox vaccine is growing. That is my concern. On Saturday, July 23rd, 2022, the World Health Organization declared that monkeypox was a global health emergency. Global health emergency. We will be able to see the surge, maybe not in the United States at the same pace, but it's going to happen around the world. When it happens around the world, then you're going to see the demand be thinned. Please let me remind you of the ventilators of yesteryear when we first began to fight COVID-19. We had no test protocol in the past administration. We had no vaccine. And so what we were being treated with were ventilators. And I recall distinctly the crisis of governors having to get out on the open market and bid for ventilators that they had run out here in the United States. we cannot have that happen. We've already been exposed to what we can do better, and I'm calling on our administration, which has been the lifeline of all of us, as we passed the American Rescue Act and provided an enormous amount of money to set up the testing protocol for free, which we need to reignite on coronavirus, COVID-19, and also the issue of vaccines. It got so that you were getting vaccines mailed to you, you were getting them online, you could get them at any access after we did the vaccines that had to be implemented by a medical personnel. That's the way America should be. That's the way Houston should be. That should be the way Texas should be. So this is the second time in 2 years the World Health Organization has taken the extraordinary step of declaring a global emergency. This time the cause is monkeypox, which has spread in just a few weeks to dozens of countries and infected tens of thousands of people. Monkeypox has been a concern for years in some African countries, but in recent weeks the virus has spread worldwide. Some 75 countries have reported at least 16,000 cases so far, roughly 5 times the number when the WHO advisors met in June. According to the Department of State Health Services, 76 Texans have been diagnosed with monkeypox to date, according to our information and data, 27 of those in the Houston area. As of July 22, 2022, a total of 900 confirmed orthovirus monkeypox cases, a designation established by the Centers for Disease Control and Prevention, have identified with over, as the number has grown since the early number, over 839, now the number seems, in New York City. The Houston Health Department announced on Friday, July 22nd, 2022, that they had received a shipment of 5,000 doses of the monkeypox vaccine. And I applaud that shipment. The question is, what happens when the supply chain is interrupted? According to the Houston Health Department, the department will keep 3,516 doses and provide 1,508 doses to Harris County Public Health. And I know that they met this past Tuesday to express their concern and also protocols out of Harris County Health. Nearly all the infections outside Africa have occurred among men who have sex with men. The outbreak has galvanized many in the LGBTQ plus community who have charged that monkeypox has not received the attention it deserves and has happened in the early days of the HIV epidemic. I'm calling the alarm because no community who faces a particular health challenge should be subject to being without the kind of health care they need. But I will remind you again that this is not a sexually transmitted disease. This is by skin contact, bodily contact. That's how we have children that could be diagnosed. Misunderstanding on this point will lead to the spread of infections, and as well, it will give us a sense of comfort, and that I don't want us to have. In beginning of COVID, there were rumors about how you were able to get COVID. And in fact, people were silent about getting it. They felt that they had done something wrong, that this was devastating, that this was something that you shouldn't talk about. They were whispering. Unfortunately, the national protocol of the former administration was don't talk about it. It doesn't mean anything. It's not devastating or deadly. I want us to be out in the open, and I want to repeat myself over and over again that it's not sexually transmitted at all. How does monkeypox spread? Monkeypox spreads in different ways. The virus can spread from person to person through direct contact with the infectious rash, scabs, or body fluids. And I wanted us to see obviously the boils. It's painful. My doctors will tell me it's on the order of a smallpox or measles, chicken pox. It got the pox word in it. And anybody who's had those know that that is not very pleasant. It's certainly not pleasant for our children. Monkeypox spreads in different ways. The virus can spread from person to person, as I said, through direct contact with the infectious rash, scabs, or body fluids. It can also be spread by respiratory secretions during prolonged face-to-face contact or during intimate physical contact, such as kissing, cuddling, sex. In addition, pregnant people can spread the virus to their fetus through the placenta. We need to be concerned about monkeypox. We need not to be irrationally fearful, but we need to be concerned. It is also possible for people to get monkeypox from infected animals, either by being scratched or bitten by the animal, or by eating meat or using products from an infected animal. People who do not have monkeypox symptoms cannot spread the virus to others. Monkeypox can spread from the time symptoms start until the rash has fully healed and a fresh layer of skin has formed, which is a little different from coronavirus because we have a countdown. It's 5 days, 10 days, do you test negative? But this has a different type of ability to spread. Monkeypox illness typically lasts 2 to 4 weeks, in which time the infected person should quarantine. Monkeypox infection symptoms are symptoms of monkeypox: fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters that appear on the face, include them inside the mouth and on other parts of the body, like the hands, feet, chest, genitals, or anus. Sometimes people get a rash first, followed by other symptoms. Others only experience a rash. Symptoms usually appear 1 to 2 weeks after infection. What treatments are available for monkeypox? There are no treatments specifically for monkeypox virus infections that have come to my governmental knowledge. However, my experts here will tell me whether or not we were able to move forward on that. However, because of genetic similarities in the virus, antiviral drugs used to treat smallpox may be used to treat monkeypox infections. Antivirals such as Tecoromat, let me just say TPO-XX, may be recommended for people who are more likely to get severely ill, like patients with weakened immune systems, which is why I'm very concerned as well. We have many of those in this community. One of the things that we knew with the COVID-19 is if you had an underlying condition of diabetes, you had a very high propensity of getting very sick previously without the vaccines. And when we started the vaccines for COVID-19, if you recall, we started in the older population and we started with people who had immune compromise. And you're seeing that right now. Because monkeypox and smallpox viruses are genetically similar, vaccines developed to protect against smallpox viruses may be used to prevent monkeypox infections. The U.S. government has 2 stockpiles vaccines, JYNNEOS and ACAM 2000, that can prevent monkeypox people who are exposed to the virus. Vaccines may be recommended for people who've had or may have contact with someone who has monkeypox, or for health care and public health workers who may be exposed to the virus. I think that is a very important point that I want to make, that I want to take care of our health professionals that may be caring for these individuals. And the question is, do we ramp up the vaccines so that they can be vaccinated as needed and as necessary and as dictated by health protocols? The blueprint for control of disease is vaccines and therapies to aid in the recovery of the infected. We know that vaccines work. The spread of COVID-19 has been impacted by the availability and use of vaccine. Our president was tested positive, and all of his physicians have indicated that his symptoms are less than severe because he's been fully vaccinated, but he is still being monitored by a physician, his physicians. Today we are at the beginning of another global health emergency. I didn't call it, the World Health Organization called it, and they've called it pretty soon. It's not next month or in September. They've now announced that we have a World Health emergency in monkeypox, and they can see the landscape around the world. And we know that we are no longer immune because COVID-19 came to us internationally. And it was thought that it came from one direction, and it actually came from Europe. And so this is what we have to recognize, and we are surrounded by any manner of entry that can bring this in. And people should not think border entry. People can fly here and still possibly be contagious. Obviously, COVID, you couldn't basically see physical signs except the coughing and temperature and other means. This has physical views of the rash that could be seen. And so this is our call to action for vaccine production here in the United States, or a definitive supply line that cannot be broken, that comes with a level of security that we never have to doubt that we will have enough for this very large country. The blueprint for control of the disease is vaccines and therapies, as I said. We know that vaccines work, as they did at COVID. Today, we're at the beginning of another global health emergency, and we have insufficient amounts of vaccine to stop the spread of this highly contagious disease, particularly in a city like Houston that has to spread out that distribution. The Congressional Coronavirus Task Force that I chair is taking up the mission of moving policy forward on getting a domestic manufacturing plan in place that will be sufficient to meet the domestic need for this vaccine for monkeypox if and when it spreads extensively. The reported cases are likely a fraction of the real infection rates, and these cases are likely to rise with the beginning of school year in August. Possibly, people are on vacation and traveling to many different parts of the world and will be coming back. This is the first time since the eradication of smallpox and the end of providing smallpox vaccination has the world faced a similar ailment. So let me indicate that the work that we want to do is to be upfront in saying to the community, we have a problem, potentially, and saying to the policies that we need to include vaccine production in the United States. We need to make sure, which I'll say at the conclusion, of how to make sure that you don't get monkeypox if you have a loved one that has it, or you want to be concerned about how you can best handle that. I will provide that information shortly. But I do want to invite the professionals that have come here and joined me today. I'm excited about their presence. First, I'd like to call Dr. Winston Luau, and I want to make sure I've pronounced it correctly, Doctor, Chair of Population Health and Health Systems, University of Houston College of Medicine. Doctor, thank you so very much for being here, but also thank you. I don't think we have, in this generation, focused a lot on infectious diseases. I think the COVID-19 opened our eyes that they still exist, and that your work is particularly important, the work of Dr. Hortez, Baylor College of Medicine, collaboration that you all have in our other hospitals, and of course, all of the public sector, that it is extremely important to make sure that we have the right information. So would you come now, please? Thank you.
Good afternoon. My name is Winston Liao. I'm a family physician, and I'm chair of Health Systems and Population Health Sciences at the University of Houston Tillman J. Fertitta Family College of Medicine. I just wanted to thank Congresswoman Sheila Jackson Lee for her leadership on this issue and for her support of the College of Medicine and University of Houston. She's wise to raise the alarm on this issue and wise to call for the increased production of vaccines for monkeypox. At the College of Medicine, one of our missions is to produce more physicians that are going to be working in the 3rd Ward, the 5th Ward, and the East End. And we hope a lot of them are going to be practicing primary care, and they will be able to deliver vaccines and deliver antivirals like tecovirimat, and also provide education, the education that people need to know how to deal with their symptoms. This is an important public health issue that is relevant to all Houstonians. As the Congresswoman mentioned, monkeypox can affect anyone. It's relevant to all of us because of how it spread. It spread through direct contact with the rash, the scabs, body fluids, through respiratory secretions, through prolonged, intimate face-to-face contact, through coming into contact with infected linens and towels, through coming into contact with infected animals. It is different from COVID, and yet our experience with COVID really prepares us for to take on this challenge. For example, it has a long incubation period, so about 10 days. And that means that we're able to identify the people who are sick and to isolate them, and then also to tell other people who have been exposed that they need to quarantine or make sure that they're not coming into contact with other people. There's also not a lot of asymptomatic cases, so people are less likely to unwittingly expose others to the infection. There's also a characteristic rash, and that's why it's really important to partner with your primary care physician in order to have somebody examine you if you think you may have come into contact or you think you have a rash that you're not sure what it is. It's important to to communicate with your primary care physician in order to figure out what to do next. We also have this robust contact tracing system, and it's important for us to all adhere to that contact tracing system, and that the contact tracing system is an important measure to make sure that this infection does not spread. And as the Congresswoman mentioned, we have vaccines and antivirals that are available, and so that's a really important tool in the fight against this infection. And thankfully, they have already been developed, and as the Congresswoman mentioned, we need to enhance the production of these vaccinations so that we have a secure supply, so that we have enough vaccines to meet the demand. One of the important tools is to vaccinate people who have come into contact with people who have already been infected. And so if we can vaccinate all the people who have been exposed, that will definitely reduce the spread of the illness. So in summary, the Congresswoman's call for alarm, I think, is wise and well heeded. And if you have questions and you have symptoms, you have concerns, please make sure that you are reaching out to your primary care physician. Thanks again for your leadership.
Doctor, thank you so very much. Dr. Lau, thank you so very much. We know that, as the doctor indicated, that we will see these cases either in our public clinics, or we'll see them in some of the hospitals that deal with vulnerable populations. And so there's the medical center, and as everyone knows, we have one hospital that sits at the edge of downtown Houston that has really been designated as the hospital that would respond first in the midst of a medical crisis in this area in particular. But one thing that I think is important to note, this hospital also deals with individuals who are homeless, vulnerable populations, and as well individuals who are suffering from mental health crises. Vulnerable populations are more susceptible, or can be more susceptible to these circumstances, and I want us all to be prepared to take care of people from all backgrounds. And so I'm delighted to have Dr. Stacy Wells from St. Joseph's Hospital. Doctor?
Thank you, Congresswoman, for inviting us here and calling us out for this very important healthcare crisis. My name is Dr. Stacy Wells. I'm an internal medicine physician for St. Joseph Hospital. I am a hospitalist. I primarily work in the hospital. Thankfully, at St. Joe's, we have not yet had a case of monkeypox, but if we do, we are more than ready. At first, we need to just address some misinformation. So I'm just going to start from the basics and tell you a little bit about monkeypox. Monkeypox is a rare disease caused by infection with the monkeypox virus. Symptoms are similar to smallpox symptoms in terms of a rash, but milder. And monkeypox is rarely fatal. And rarely does it require hospitalization unless you are immunocompromised. It spreads from person to person when you come in contact with the virus from an animal, human, or materials contaminated with the virus. This, just like was said, towels, bed sheets, clothing, utensils, things like that. The virus enters the body through broken skin, and even when the broken skin is not visible. The virus can also enter the body through respiratory tract and mucous membranes, eyes, nose, mouth, kissing, spitting on someone, any contact with secretions in that manner. Human-to-human transmission occurs mainly through direct or sexual contact with bodily fluids or sores, or indirect contact with contaminated materials. Other human-human transmission methods include contact with respiratory secretions. At this time, we do not believe that people are infectious when they do not have active symptoms. And what are those symptoms? a fever over 100.4 degrees, chills, swollen lymph nodes specifically in the neck or the groin or the armpit, a skin rash. So the skin rash usually presents in 3 specific phases. Raised bumps that then progress to fluid-filled sores, and then finally large pus-filled sores. Eventually these sores will scab over and fall off. And once the skin develops underneath that remaining pit, you are no longer considered infectious. Infection with monkeypox lasts 2 to 4 weeks. So what do you do if you are exposed to monkeypox? If you believe you are exposed to someone who has a monkeypox virus, you consult your physician or your healthcare provider immediately. Get tested. Avoid gatherings, especially if they involve skin-to-skin contact, such as hugging or holding hands. Think about people you've had intimate contact with over the last 21 days. You might be asked to notify them of your diagnosis to help stop the spread. If you have actually contracted monkeypox, you self-isolate. You consult your physician, and you locate state health department immediately. Avoid all skin-to-skin contact. Do your own laundry. Use utensils, linens, towels, electronics as separate from members of your household. Frequently clean touched surfaces with a disinfectant, very similar to how we combated COVID-19. And wash your hands frequently. Use the 20-second rule. In the Houston area, we have had over 24 cases of monkeypox. They have shown up in our Harris County. The threat of monkeypox to Houston's general population remains low, but again, as was stated, we are concerned about our immunocompromised communities. About 90% of people who have had monkeypox, they need to just stay home. They rest while recovering from the virus. As was stated, there is a monkeypox vaccine, and access to this vaccine is going to determine whether we can control and contain the virus. Vaccines will be distributed to those at the highest risk of infection first. Receiving the monkeypox vaccine can help lessen symptoms up to 14 days after exposure. For babies, pregnant women, immunocompromised, and those who are experiencing severe symptoms, there is treatment available which can be received in clinics or hospitals. The fact that this virus has targeted some of our most vulnerable communities, our LGBTQ plus communities, as well as communities that just aren't prepared because we have not been exposed to this virus before. It calls for an action to do things different. We need a vaccine now before this becomes completely out of hand. So I really appreciate our Congresswoman for calling this press conference, shedding light on this vaccine issue early, and helping us move forward with this epidemic. Thank you.
Thank you so very much. Thank you on behalf of St. Council. We have listened to the research and medical school representation, preparing doctors, I think even more and more, for facing infectious diseases. We have heard from a hands-on medical professional in our hospitals or in a hospital. I think it is important as the federal government works, we work with the state. And I'm delighted that we have Dr. Caitlin Cutter, Regional Communicable Disease Manager for DSHS, regional representative, who we will call on and who we work closely with on these issues. Dr. Carter, you would come, please. Thank you.
Thank you so much, Congresswoman Jackson Lee, for holding this press conference, which is so important right now. to so many sectors of our community. We do have several individuals that have been infected in the Houston, Texas region and across Texas, as well as across the nation. Right now, the vast majority of those people are people who self-identify as men who have sex with men, so the gay and bisexual male community. However, there's no reason that this virus needs to stay in that community, and that's what our colleagues have been mentioning before, is that it is not a strictly sexually transmitted infection, that there are multiple other ways that this infection can be transmitted. The most vulnerable individuals in our society are actually pregnant women, the immunocompromised, and children. So those are the people that we really must protect. And I agree with you, Congresswoman, that ramping up our response, vaccination, and treatment options, as well as testing for these communities, is very important. Texas has already ordered our full allocation right now from the CDC Strategic National Stockpile of Jynneos. That vaccine is produced in Denmark. The FDA does investigations of the manufacturing process, and when they're finished with that investigation, then the country, the nation, is cleared to accept these vaccinations. So those vaccinations have come from Denmark to the CDC, and then they've been allocated to the states. Texas has been allocated 20,000 doses, including 5,300 doses in Houston. Our country has also ramped up testing. We have an LRN, Laboratory Response Network, laboratory here in Houston that is, there's no charge if your doctor wants to test you through that LRN. However, your doctor will need to work with the public health department to go through that LRN for testing, which includes some investigation, case investigation forms, and working with the public health department and getting approval for that. Also, Quest and LabCorp are now providing testing. Quest and CDC are the only two entities right now that can do the confirmatory testing. The other orthopox virus testing can let you know whether you're probable, but in order to fully confirm monkeypox within the orthopox virus family, we need to test specifically for the monkeypox virus. And I just want to thank you again so much for holding this press conference.
Doctor, I'm going to ask you to come up just one more, because the information, Doctor, I'm just going to ask you to come up because I think it is very important. Let me have you, with respect to the process of going to your doctor, you're not tested in the office. You have to get referred to a lab?
Oh, no, that's not what I meant to say.
All right.
So testing in the office, as my colleagues know and mentioned a little bit, involves swabbing of the lesion. But then what needs to happen is that swab needs to go into a tube, and then that's sent to a laboratory. So the important laboratories here in our location are the Houston LRN, it's a public health laboratory, and then the national commercial laboratories.
So you can go, I just want to repeat so people know, you can go to your local provider, your physician, to be tested if you think you have the symptoms, which we're going to repeat over and over again. And then that physician will take the test, which is to deal with the scab, and then it has to go to a lab to be determined specifically for monkeypox. And then you mentioned Quest, and how does that work?
Quest and LabCorp, and your physician can also work with them directly and can use the same box, that they would normally work with to send samples out, so it's easier for your physician that way.
So it is not a circumstance where you can drive up, or maybe it is, you can drive up to a Quest or another lab and say, test me. Is that my understanding?
Correct. That is not possible right now. You have to go through your physician, but they can go easily through Quest and LabCorp.
Right, the physician can.
Yes.
Right. I think that's very important, because there's somebody listening right now that is trying to ask where can they immediately show up and be tested, possibly. And I just want us to be very clear. Please, if you, as was indicated, have fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters that appears on the face, inside the mouth, and on other parts of the body like the hands, feet, chest, genitals, or anus, please seek medical assistance. The other point that is extremely important is that you must quarantine. This is a disease that requires and hopes out of your responsibility that you quarantine so that you do not infect other persons, even in your family. The vulnerable people that all the doctors seem to agree are those who are immune compromised, pregnant women, if this was to begin to spread, and our friends in the LGBTQ plus community. But let me be very clear that this can be spread by other means, and this is not a sexually transmitted disease, and so you can feel comfortable that that is something that is in an isolated population. Again, I want to be very clear. We don't do public health a favor when we try to stigmatize and isolate and say that this belongs in a certain community and no one else is potentially has the ability to be exposed. So I want to be very clear on that. I want to thank the doctors. As I conclude, I want to just again remind us of how to prevent getting monkeypox. Avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Please have these examples shown that looks like monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox. If you have it, take care of your own items, if you will. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Vaccination as a post-exposure treatment to prevent monkeypox symptoms. That this is important for healthcare professionals at the stage of the disease spread to keep healthcare workers available, to provide care to patients who not only have monkeypox, but COVID-19. So I really want health providers to be able to get the right kind of information as to when they should have access to the monkeypox vaccine. If someone, or if more than one or two wind up because of their immune situation, pregnancy, or other situations, have to be hospitalized. The CDC Advisory Committee on Immunization Practices recommends that people whose jobs may expose them to orthopox viruses, such as monkeypox, they get vaccinated to protect them if they're exposed to an orthopox virus. This is known as a pre-exposure prophylactic type of approach. Clinical laboratory personnel who perform testing to diagnose orthopox, including those who use polymerase chain reaction, if I've got it right, PCR, assays for diagnosis of orthopox viruses, including monkeypox. So PCR. I won't try to pronounce the entirety. PCR. And the ACAM 2000 vaccine is administered as a live vaccine, a virus preparation that is administered through the skin by pricking the skin surface. So, and following a successful inoculation, a lesion will develop at the site of the vaccine. The virus is growing at the site of this inoculation. Lesion can be spread to other parts of the body or even to other people. I believe it is important, again, that the gist of what we want to see happen is for the administration to recognize that we have been confronted by supply chains and crisis before. We understand that part of the vaccine comes from Denmark. Certainly that is an ally of us, but it is part and has to be shipped here, and any manner of interruption could occur. I'm very glad that the state of Texas has, at this point, 20,000 doses, but they've already distributed, at this point, I believe, 5,000 plus to the city of Houston. The city of Houston will distribute about 1,500 to Harris Health. That's good news, but I can't emphasize more as I conclude and open to questions. Here is the point. Here is the point. In the early stages of COVID-19, there was a bidding war for ventilators. It then became a desperate run on vaccines. We saw it all over the country, long lines people concerned that they couldn't get a vaccine or they couldn't get tested. There were long lines for testing. And that did not bear well for diagnosis or treatment. Even as we recognize the less deadly aspect of monkeypox, I'm always of the view that we in the federal government have to be the umbrella on a rainy day. We don't know what might happen. By science we can predict, but we don't know what might happen. So, the United States must have control of manufacturing, distribution, and the availability of monkeypox vaccine. I believe we have the capacity with the various pharmaceuticals that we have here to begin to look at being prepared by manufacturing being on site. As a parallel, we should make sure that we have enough stored vaccine on site and that we have enough collaborative partnerships with the companies that are producing the vaccine. And I say this over and over again because monkeypox can really spread around the world. And there'll be desperate populations that it is so intense that we will have to be ignored and they will have to go where the crisis continues to grow. And a lot of the developing nations and continents will have to take maybe priority. And finally, I want to say that we know that BA.5, which is part of the COVID family, is now one of the most infectious aspects of COVID-19. It is believed that is what the president is infected with, and it is going through our population extensively. I'm not sure what will confront us as school begins, but again, we want to be prepared for our children to be safe in schools, to be able to go to schools, our teachers to be able to be safe, our persons handling millions of children across America. And then I have the greatest concern for pregnant women and other vulnerable populations. That is why we cannot wait any longer without a protocol and plan to have vaccines on site for the American people. We must do it now. I hope as we proceed in the vaccine summit tomorrow to go over how we utilize vaccines in the fight against COVID-19, we will recognize that the United States is not immune from infectious diseases. We are not immune, and it is very important that we respond accordingly. We'll take any questions at this time. Questions?
The infection prevention protocol, would that be masking